You may not hear this from global media headlines all the time, but Africa is also being hit hard by the coronavirus. Over half of Africa's countries have reported over 400 positive cases as of March the 17th, and seven people have died. International flights have been cancelled, schools closed, and travel from coronavirus-hit regions restricted. South Africa declared a national state of disaster on Sunday, with the number of cases brought by overseas travelers increasing. Is an outbreak imminent, and how real is that danger? I'm now joined via Skype by Wang, Wenwen, reporter from Global Times, who covered Africa extensively as a reporter, and from Nairobi by Douglas Okwatch, senior editor from CGTN Africa. Douglas, I want to begin with you. When some people talk about Africa, it's as if it is a monolithic whole, as if Senegal is the same as Ethiopia or Egypt the same as DR Congo. But we know this is a big continent. It's a complex continent. 400 positive cases so far. That doesn't sound like a big number. Are some regions worse hit than the others? What's the situation on the ground?
What we have been seeing in Africa is that there is an escalation, or we are seeing the beginning of an escalation. Initially, countries would report 1 or 2 cases, and then it would appear to stagnate. But now we are seeing those countries that were reporting 1 or 2 cases are now beginning to report more and more cases. So there seems to be a proliferation of cases. And like you say, out of Africa's 54 countries, almost 30 countries have now reported cases of the COVID-19 or coronavirus. So what we are seeing is a situation where I think the window of opportunity for Africa is closing very rapidly. Africa did have the opportunity to clamp down on the virus, to prevent the virus from entering its borders, but that window seems to be closing. So we might be bracing for this could probably be the lull before a big storm. And what we are witnessing is that African leaders, African governments, are beginning to really be proactive, to put their foot down and do something. For example, in more recent days, we've seen South Africa's President Cyril Ramaphosa roll out a raft of measures. Kenyan President Uhuru Kenyatta has also very recently rolled out a raft of measures to slow down the virus. So some of the things that African countries are doing are, for example, limiting or banning gatherings. Some countries have closed institutions of learning, but that isn't really enough. So each country, each government is in its very own unique situation, like you pointed out in that opener. And one of the panelists mentioned something very interesting about culture and the whole idea of social distance. So while that might be very easy to enforce in other cultures, in other countries, in other setups, that might be a challenge in Africa, because even the very nature of the African economy is an economy where a majority wake up in the morning to go to work, to look for money, to buy food. So the whole idea of keeping people at home might be very difficult to enforce in Africa. However,
but according to WHO and major epidemiologists and experts on the ground, social distancing is a proven method to contain and control this epidemic. So should there be more cases, imported cases from overseas, what must be done by the authorities to make sure that people are quarantined, are isolated soon enough?
Social distancing is a good thing. Of course, it's been effective. As you've pointed out, in some other countries, it has worked quite well. And I think what African leaders and African governments are trying to do is to request people who suspect they may have contracted the virus, or who think they were in contact with people who had the virus, to self-quarantine. I think that is working very well in some situations, but we are not too sure how well that can work to keep the virus at bay. So that is just but one of the methods that governments are trying to use to limit the number of people that are in interaction with others, and therefore enabling the virus to to spread very quickly. Like I just mentioned, the step about closing institutions of learning, but also the problem of sanitation in Africa. You know, a majority of Africans still are very rural based, and even in urban centers and cities, many of them live in informal settlements, and we have sanitation situations there, lack of running water. So Africa may need help. The weak link in this fight in Africa might actually be the health system, which is very weak. So the help, the support Africa needs probably would be health experts to come and join hands with other African experts. Africa will need sanitizers.
Right.
Africa will need a lot of help from the other end, and also training of frontline staff to boost the fight against the coronavirus.
Douglas, of course, there are many challenges over there. I want to bring in our colleague Wenwen from Global Times. She was a reporter in Africa who covered the continent extensively. So Wenwen, what are your biggest concerns right now regarding the situation in Africa?
Yes, right now I'm a little worried about the capability of African governments handling the infected cases. Although Africa has got enough time to prepare for any worst-case scenario. Right now, they have already got temperature checks at airports and have quarantine regulations for visitor arrivals. But there are still problems, like whether the coronavirus will turn out to be a seasonal disease. It is a very open question now. And I'm also worried about the anti-China sentiment in the continent. And I saw from news reports that in Kenya, people have already felt anti-China sentiment, and some of them are quite vocal about Chinese presence there. So if the situation runs out of control, people's attitudes towards China will be a big problem.
Sure, I saw some of those reports and videos on social media as well. When talking about infectious diseases, Africa is really no stranger to those. Ebola outbreak a couple of years ago killed hundreds of thousands. Many countries in Africa still have the medical facilities and expertise in place, when they fought the Ebola outbreak. How do you think those experiences can enlighten the current authorities, people on the ground when it comes to fighting coronavirus?
Yeah, I think they have already got the experience of fighting Ebola, so they know how deadly the virus can be. So people may be self-conscious and self-disciplined when the government set restrictions on them and tell them to do some social distancing and those kind of things. And also the facilities set up during the Ebola outbreak will definitely help African governments to deal with the current crisis now. And the problem is that I think African people need to see the difference between those two kinds of outbreaks and be alert about the situation elsewhere, so they can be better prepared for the situation on their soil.
Well, very quickly, what is China doing to help Africa right now?
China has sent China's disease control centers has sent medical workers to Africa, and also we know that some private enterprises are sending medical material and resources to aid the continent. And also we have a lot of people-to-people exchanges about how to aid African people at the public level. And also at the government level, China is working closely with the countries in Africa and to show them China's experience, such as city lockdown and temperature checks and those kind of things.
Well, Douglas, we have about 40 seconds left. Your message to those those in Africa who blame China for this ongoing coronavirus outbreak.
I think this is as a result of misinformation. And one of the things the government is trying to fight is this scourge of disinformation, which plants into people's minds the wrong perception about other people. As has already been observed by other panelists, this virus is a global problem. So what we need now is not to stand apart, but to stand together and fight it together. We see it as a common enemy. Instead of splintering people in terms of race, in terms of place of origin, that would be very helpful. So that would be my message to those who are spreading this misinformation.
All right, Douglas Okwatch, senior editor from CGTN Africa, and Wenwen, reporter from Global Times, who covered Africa extensively. Thank you so much. And that will do it for this edition of The Point. As always, follow us on Facebook and Twitter using the handle The Point with Alex. Download CGTN to watch our show. Thank you so much for watching. I'm Wang Wenwen in Beijing.